Hello, I am Mike Schilsky, Professor of Medicine and Surgery at Yale University, and as Chair of the Wilson Disease Association Medical Advisory Committee, I would like to welcome everyone to the first day of our virtual Wilson Disease Association conference. This meeting was organized and also sponsored by the Wilson Disease Association, but to share it with you in this professional format was made possible through generous corporate sponsorship of this event. On this opening day of the meeting, we would like to honor our sponsors for their support of the Wilson Disease Association mission to advance patient care and conduct research to benefit current and future generations of patients with Wilson disease. This is a unique moment in time. We are approaching nearly 70 years since the first therapies were introduced for Wilson disease. We have come a long way since then with improvements in disease diagnosis, major advances in our understanding of the underlying basis for Wilson disease, and clinical efforts that have revealed the many ways patients may be affected by this disorder. Care for our patients with Wilson disease has also evolved, and at the Centers of Excellence as designated by the Wilson Disease Association, a multidisciplinary model of evaluation and treatment has become the standard for care. Along with the current very rapid and accelerated pace of technologic advancement, a natural partnership has developed between members of the Wilson Disease Association, other Wilson disease patients, members of academia, governmental agencies, and also industry partners. These groups have joined in a number of efforts to help advance diagnosis and treatment of this disorder. Pharmacologic treatment of Wilson disease has been a great example of these partnerships from the outset, when the first oral therapies were developed in the 1960s. These efforts have continued to evolve to help fill in the gap of unmet patient needs at a faster pace than if we worked in independent silos and ignored the efforts of other partners. As we reach the year 2021, we will have new opportunities to take advantage of the age of molecular and personalized medicine with the prospect for gene replacement, repair, and other targeted therapies, as well as improving on and expanding the use of existing therapies. In the near future, we will not only continue to address the underlying basis of Wilson disease, namely therapy directed against the accumulation of copper, but for those suffering from advanced disease, find ways to reverse disease in the liver and other organs. Along with the development of new treatments will come a better understanding of how to find the safest and most efficacious therapy or combinations of therapies for our patients. I want to thank you for the opportunity to introduce and give context to this next segment of the meeting, and look forward to sharing with you over the next few days. Without further ado, I turn the meeting back to our Wilson Disease Association representatives to introduce the individual sponsors.